Hi, my name is Scott Tharler, contributing editor here at Healthcare IT News. Welcome and thank you for attending today's webinar, The Identity Imperative for Healthcare Providers and Payers, Overcoming Barriers in Digital Transformations, sponsored by Okta. Amidst a paradigm shift, the healthcare industry appears to be solving one problem while creating another. On the one hand, healthcare organizations are turning to technology to help them curb costs while adopting new care delivery models focused on improving patient outcomes and access to services. Yet, these digital transformations present their own set of challenges. Given the dual needs of ensuring both reliable security and a seamless end-user experience. In this session, our experts will address challenges with healthcare identity, enabling efficient partner collaboration and reducing security risks, and ways that modern identity provides seamless, secure employee experiences. Our speakers today are Sergio Pineda, Information Security Manager at Envision Healthcare, and Ron Piavizan, Senior Director of Business Development at Okta. So, Sergio, tell us, what does identity mean to you?
Hello, everyone. Identity means to me everything, that representation of everything that you are entitled to, and you are on the digital world. With that, I mean the authentication, authorization, accountability that I have to any system or any application or anything that is embedded into the digital world. That's for me identity, and that's an important definition, because from that definition you can start several conversations around each one of these criteria and definitions.
Yeah, absolutely. And this is Ron, and thanks everyone for the opportunity to speak. And yeah, that's a great point, Sergio. And you know, identity is something that we obviously think a lot about at Okta. I mean, to us, within the healthcare realm, it's, you know, it kind of boils down to two things. It's productivity, making sure that the right person has the right access to the right application. So obviously in healthcare, it's making sure, you know, primary responsibility is making sure that clinicians and doctors and nurses can access the right application at the right time, and make sure they have the right permissions to do so. And then of course it's about security, that making sure to protect that user, because the user now is at the center of attack, and we'll be discussing this a little bit more during the presentation. So we need to protect them so they don't get attacked by hackers, so they can go about and do their important work, which is of course making sure that people stay healthy and happy. So why don't we just, yeah. So what are we going to be talking about today? You know, Sergio and I have had a number of discussions about, you know, how we want to present and what we want to talk about and make sure that gets highlighted for you, the audience. And really there's, you know, we want to talk about a few things. One is, of course, enabling the healthcare ecosystem. And there are multiple personas that need to be managed and secured in order to provide patient care. Patient care does not happen through one person or you know, through one doctor. It happens through a whole network of clinicians and therapists, and they're all working towards a common goal of great patient outcomes. So we want to talk about how do we enable that. How do we optimize for provider productivity, so those people who are providing that care, how do we make sure that they stay productive and they're able to access the applications they need to. And then a little bit what we just talked about, making sure that they do so in a secure manner, because Sergio, as probably you know as well as anybody, this is not a group that really likes technology. So we need to find a way to make things as efficient and secure as possible for them.
Correct, and I think that's one of the main challenges here. You need to protect the environment. You need an identity provider to centralize security controls, but at the same time, you have to make sure that productivity doesn't get lost, right? So that is, of course, security is always at the top on the digital transformation for securing and making sure that you are complying with the standards, protecting your users, but at the same time make it easier for them to access the resources they need as soon as possible. So that's the main challenge here.
It'll be a good conversation. And And I think we all know this, but this is a uniquely difficult space because this is an area where it's not a question of if, but it's a question of when you're going to be attacked. And here you have we threw up a couple of numbers. 91% of all healthcare orgs have reported a data breach in the past 2 years. And this came as a particular shock to me. But the price of a medical record on the black market is actually 8 to 10x the price of a credit card information. And it's interesting when you think about it, because medical data is very valuable. You have personal information, you have billing information, you have insurance information, you have employment data. And this is all really valuable for identity theft. It's very valuable for fraud activities. You can use identity to buy medical equipment or drugs. So the data that we're protecting here is extremely valuable. So it's no wonder that virtually everyone is going to get attacked at one point or another. And this is something that must keep you up at night constantly, Sergio.
That's correct, and I think that's a great phrase, right? It's not about when it's going to happen. You have to assume that it's going to happen at some point, and you need to be ready for that, right? To minimize the risk, to minimize the surface impact, and to be able to have a strong security posture. Because nowadays attackers are becoming more and more people-oriented or focused on a specific targets, and not in any industry, but on the industry world, in the healthcare industry, has become more and more common to have all sorts of attacks targeting the people that have access to medical records or that are more exposed to healthcare activities. So that's completely right. It's a matter of when this is going to happen and how well prepared you will be when that happens, right? And identity and access management is one of the key elements of cybersecurity that you need to secure and protect.
And that's what we're talking about here, is protecting the users, which in turn protects the patients. And there's a lot of guidance out there. So HIPAA has definitely had some standards about how and when certain records can be accessed and what kind of authentication you need when accessing those records. And even though obviously not strictly healthcare related, but NIST provides a series of recommendations that are useful and can be applied into the healthcare market on how to protect identity, what is strong authentication, when to use things like multi-factor authentication, and the role of multi-factor authentication in the role of protecting identities.
Right, and all of these regulations and standards, sometimes it feels like regulations will be or are there just for check marks or to just to have something that tells that this company complies or anything, but these regulations actually guide or should guide your strategy to improve your security posture, more on the identity and access management world, right? You will find HIPAA and INIS several controls and a big domain related to identity and access management that you need to take them into account as a security manager or a director of security or chief security officer, that you need to take into account to make sure that those controls will be in place and that you will find the processes, the technology, and the people required to implement those security controls being guided by these regulations or standards. So standards and regulations are there for one reason, and the reason is to actually minimize the impact whenever you are attacked, as we talked a minute ago. So that is the challenge. You have all these digital transformation. You have to protect your users. You have to make easier for the users to access the resources they need. And at the same time, you need to comply with these regulations, but also taking into mind that this is going to help us to be prepared, right? So regulations should guide your strategy around any security domain, but in this case, more specifically to identity and access management.
Yeah, and it's nice that the regulations are keeping up, because I think there is a general understanding that one of the main attack vectors is no longer infrastructure. Like people aren't taking down firewalls anymore, or if they ever did, they're not taking down firewalls, but they're attacking other users. So hackers are targeting users and attacking users, and it's nice that there's a broad understanding of that, and there's regulation to support that, and then of course there's people like Okta that provide products and services that help deliver that as well.
Right, and attacks are now more focused on profiles and identities, right? Because in the past, it was just infrastructure. This is a company. The company has its network. But right now, the number one type of attack vector and more vulnerable asset in your environment is the identity of the people, right? That I am able to identify a profile and that I know that I can send a phishing email or I can just try to steal the identity of that person. That will give me access to the entire network without even trying to target that network from the network and infrastructure perspective.
And that's very much what we're going to be talking about for the rest of the presentation. Is we're going to sort of begin to break it down into the various personas, and then provide a few thoughts on who these personas are, and then the challenges associated to protecting those identities. So first and foremost, obviously, it's the provider, right? It's the doctors and the nurses. It's the ones. These people have a lot of access. They require a lot of access. It's not a population that generally likes technology. They need to access applications quickly, seamlessly, and it's really our job to protect them, right?
That's right, and I completely agree with that. This is the segment of the users population that has more access to PHI and sensitive information for the healthcare industry. At the same time, they are the segment of the users population that like technology the least, and it becomes very challenging to protect them, right? Because of that same reason, and because they are here to provide healthcare services, to save lives, to be taking care of patients. Of course, we are not expecting them to be tech savvy, so we need to enable them to access resources as soon as possible and timely manner and with the highest quality, and at the same time protect them. And I think identity providers is one of those solutions that can really help us to make that happen, especially to this persona.
But then also part of your big problem is also not just protecting providers, but also protecting partners, because there's now healthcare is now it's a team sport. There's a lot of people coming into it to make sure that your organization provides excellent patient care.
That's right. It's not just your own employees, but you also have to deal with the different partners. They will need access to your systems. They will need access to other company systems. So it's a combination of different accounts, different management from the identity and access management perspective. So you need to, this is the same risk, right? They will have access to your data. They will have access to your system. And since they are personas that go back and forth, they probably next month they will not access to your system anymore. Probably for the following month they will need it. So for this specific persona that has probably the same level of access as a provider within your system, you need to be careful with how you perform the provisioning and deprovisioning of that access, right? Because today that person needs the access. Tomorrow that access should not be granted anymore because there is not the service has finished, or there's no need for that person to have access again. So same risk, but I would say from the different provisioning, deprovisioning, and role changes perspective, these might have even a higher risk, right?
And how do you think about this group, the non-clinical staff? I mean, they need a lot of access because they're performing their administrative functions or support functions, but obviously they can't access everything because they're not clinicians.
Correct, and here you can have that segment of the population of users that require that indirect access to applications or systems to administrator, probably persons in the IT department. But another good reason to have an identity provider is that you can track down and comply with that important aspect of the AAA on identity and access management, which is authorization, authentication, and accountability. For this segment of the group, or for this persona, you will, if you have this identity provider, you will be able to say this person accessed certain application from that location, from this device to that specific system or application. So it's it's always tricky when you have administrators who have indirect access. They should not have access, but they support the application. But if you have an identity provider, you will be able to track accountability, right? You will be able to say this person accessed at certain time with all those details that I just described. So that is one of the important or the benefits of having an identity provider that can give you that information.
So let's dive into each of these. And this is a stat that I found shocking, is that when we talk about providers, they're responsible for 77% of the healthcare data breaches. And, this probably isn't because they're not paying attention, but they're the ones that have access to the most valuable data. So they're the most valuable target. So it kind of makes sense that they're going to be the most targeted. And yet the challenge for you and for others in the field, Sergio, is that these people need frictionless access to records, but that access has gotten more complex because it's not just, it used to be one doctor in one hospital accessing a bunch of records in a filing cabinet. We all know that those days are long gone. They're accessing multiple applications. They're accessing it from multiple devices, whether it's a kiosk or a laptop or a phone or a tablet. There's a huge proliferation of devices, and they're doing that from many locations. Sometimes they may not even be at your location. They could be on the road. They could be at a different location. They could be accessing from the cloud, so they're remote. So really, I think what you're finding is each of these, the problem is exponential because more applications equals more attack surface. More devices equals more attack surface. More locations equals more attack surface. So the problem isn't growing linearly, it's growing exponentially.
Yeah, and you are completely right. Doctors, providers are the favorite persona for attackers, right? They know that if they send a phishing email to a doctor, they will have very good opportunity of having access to systems on, if accounts are compromised, the attackers know that they will have a lot of chances of disclosing a bunch of information. So, and that's completely right. This is growing exponentially because the attack surface, as you say, is increasing. We have more applications, more devices, more locations. We have, and actually applications. I mean, the number of clinical applications out there that are offering services for the different types of activities that the providers need to perform on their day-to-day activities are growing. And the number of devices assigned to a person is growing as well. And as you say, one provider can be in one location to another, can go from one location to another. So if you have an identity provider that can allow you to, number one, have a centralized way of implementing security controls and immediately implement those security controls to that huge list of applications, that's, you are tackling one of the problems there. If you can allow that identity provider to be within all these different devices, right, that it's device agnostic, I will say, that it doesn't matter if it's a workstation, it doesn't matter if it's a laptop, it doesn't matter if it's a mobile device, but if you have your identity provider there, you have that covered as well. Now, from the location perspective, if you have your identity provider sending all this information to your SIEM solution or any solution that you use for your incident response processes, you can actually act immediately, because if you ingest all that information, your SIEM solution will let you know, hey, there is an abnormal authentication here. There is something, this is not a common location for that provider or for that user. So if you see the problem is growing, as you say, exponentially, but having an identity provider that can cover each one of these areas with all these different functions, then you have visibility and ways of acting and preventing any kind of security breach or any possible security incident that can lead to a data breach. So I think you really explained this very well on the attack surface. You need to be in every single place where you have an entry point for a possible compromised account.
So yeah, to actually build a little bit on what you just said, it feels like the role of identity is not just to provide simple access, like an easy access into an application, but it's to help you as a practitioner and a security professional understand the context of the individual, understand a lot more of who that individual is and what they're up to.
That's correct, because if you ingest all that information and you use it in your benefit with with your threat intelligence program, you know that persona has access to that application from that device, from those locations, and when something abnormal or when something changes, you will have that information available, and it will allow you to prevent, or even if it has already happened, to do forensics analysis and say this person had access to that from that device at that specific time. So yeah, it's not just, as you say, something that will allow you to provide or provision access to users, but from that security perspective, it's going to give you, it's going to be another technology that will increase your visibility in your environment.
And that visibility and that knowledge is now, it feels to me, that's now the front line of security.
Right. Yeah, definitely. I mean, one of the key elements of any cybersecurity program is visibility, right? If you cannot see what you protect, then you are completely lost. So having something that allows you to see all of that and that allows you to not just detect it, but also prevent it, right? Like creating rules that do not allow users to access from certain countries, or that allows you to stop authentication based on threat intelligence. I mean, you have the detection piece, but you also have the protection piece, right? It's something that allows you to create rules for specific cases when something abnormal happens. So you are completely right. It's not just about granting or not granting access. It's about also detecting and protecting from the security perspective.
And what's interesting is what we were talking about earlier is that this isn't only about your own providers, whoever's an employee or whoever's dedicated to a particular healthcare organization, but really it's about providing partner access as well, and partner security, because as we talked about earlier, patient care now involves specialists, it involves therapists, it involves all sorts of people who may only work at your particular organization on a part-time basis, on a casual basis, on an ad hoc, as needed basis, and yet all of those people still need protection as well, and they need access, but they need security. And I think what we're finding is that increasingly there's like a hub and spoke model, where you have an organization, a healthcare organization in the middle, and that has the primary relationship with the patient and maintains all the patient records. But that same organization is responsible for also providing access and security to those records and to that patient, providing that access to all the myriad of other supporting services that patient may require. Again, whether it's a specialist at another location or a therapist or whatever it happens to be. So for you, Sergio, I guess you need to begin to start thinking about, you have all these non-employees, but you need to be giving them the same access and security that you give to your own employees.
That's correct. They will have access to almost the same systems, right, that a provider has, but with the additional risk of, well, they are not your employees, and probably they will not have access to this application tomorrow because that is not needed anymore. So from the traditional perspective, you always have like a team in charge of provisioning or deprovisioning. So nowadays it's a matter of finding ways to automate these and to trigger those processes when something changes from the source of the identity. Let's say that there is a record somewhere and that person service ends tomorrow, so you need something that triggers something to terminate that user's access. Or even if that person is not going to be performing the same type of activities but others, and that requires other kinds of access, again, you need something that can help you to automate that and deprovision the accesses that are not needed and grant the accesses that are needed now. So we need to think about making sure that we are not relying just on a team that it will be provisioning or deprovisioning, but relying on automation as much as we can, because that's going to help us to guarantee that the accesses and the entitlements of all these personas are going back and forth with the same type of activity that they will be performing, right? It's segregation of duties at the healthcare provider level, or in this case, partner access required. So that's an important item to think on automation on each one of the important processes: deprovisioning, provisioning, role change.
Yeah. So the notion of identity, just to summarize what you quickly said, the notion of identity here evolves from just access security, but then provisioning also is now a key part of why you need centralized identity to manage security, because people need to be provisioned and deprovisioned, and you need to do that in an automated way. Because as we talked about, there's more applications, more locations, more everything. So you need to manage the provisioning and make sure that people access what they need to access and don't access what they can't. That needs to be automated.
Correct. Definitely.
And then there's the final kind of the final persona that we've been considering, which is non-clinical staff, and this is a unique category because they need a lot of the same access to do their administrative or support functions, but there's certain stuff they should not be accessing, even within the same application.
Right. So as you say, this is a very particular case, and you just need to make sure that you have that level of visibility on what each one of these accounts are doing in which applications, right? And again, actually connecting this back to what we were discussing on automating provision and deprovisioning. So even when you have a dedicated team to support an application, but that application has entitlements and have roles, then if you are automate that and from a centralized identity provider, you can make sure that whenever you assign that profile to that person in your identity provider, that person will only have access to what he or she is entitled to see, right? And if you have that somewhere centralized and automated, you will make sure that no one should have access to even, as having top administrative privileges to do whatever that person wants. And plus, you have the visibility, right, from your identity provider on who and where and from what device that person accesses a specific application.
So I think we've talked quite a bit about some of the challenges and some of the personas. Should we just click over now and start talking about your specific journey?
Yep. I'm good. So, it's been a challenge, right? Because we are moving as the rest of the industry. We are moving through our digital transformation, and that represents, as I mentioned before, more and more applications coming to our environment, not just provider applications, but also even homegrown applications, right? And that means that you need to federate each of those applications and make sure that you implement the security controls that you have set up in your policy. So our journey has been quite challenging because we have been Envision is a company that has gone through a lot of mergers and acquisitions activity, and as you know, acquisitions and merger always bring inherited risks, and some of these risks are, or most common risks are related to the identity and access management domain. Whether you have in a specific acquisition, they used to have other sets of policies or other settings in each one of their applications to manage control. So having an identity provider has enabled us to enforce those security controls for also those acquisitions, right? It's not just a matter of having multiple security controls in multiple applications for multiple companies, but to centralize that and standardize that. Because, you know, standardization always makes things easier for any security practitioner, because you know that whenever you have any specific case or possible incident in an application, you know that application had those security controls enforced by an identity provider. So I can tell you that we have gone through a lot of mergers and acquisitions. Also, as any other company in the healthcare industry, moving to more and more cloud applications. So it's not just a matter of protecting your on-prem environment, but also making sure that you protect every single piece of every single application or system that you use in the cloud, and enforcing those security controls to protect it from the identity and access management perspective. Having these has helped us a lot on centralizing management and centralizing those standards and enforcing them, not just for more applications, but for acquisitions, right? Which is very important from the risk management perspective.
So, and I think what I was just going to jump in with just a thought is certainly around mergers and acquisitions. I mean, that's something we see a lot happening in the industry, and as healthcare providers reach scale through acquisition. So you just to manage, we talked about the various personas, but just to manage this process of acquisition, that's pretty challenging because each new acquisition has its own, its own infrastructure. It's got its own applications. It's got its own identity. It's got its own way of managing users and provisioning and deprovisioning. And the time to centralize all that is critical, because that in between time, that's a great time for hackers to attack. But so your challenge is you need to compress that time so everyone comes onto a single identity system as quickly as possible.
Right, and that's a very important point. It's not about just protecting them, but also enabling them to have access to what they need. So with that, I mean is in case of an acquisition, you have all this group of users that need access to a specific system enterprise-wide, right? So by having an identity provider that can enable that access as quickly as possible once they are integrated as an acquisition, it gives you that possibility of granting that access as soon as possible. Yeah, sorry.
I was going to say, so what was your thought process as you guys made acquisitions and you integrated those acquisitions? What was your thought process to make sure that users had access, were both secured and had access to applications as quickly as possible?
Yeah, so everything begins with a risk assessment process, right? Of course, and to give priority to those applications that are more critical to the business. Then making sure that those applications are compatible or are ready to be integrated. And then going through this integration process with the owner of a specific application, not just from applications that were required by the users on the acquisition side to the enterprise, but vice versa, right? So we had to develop this process to evaluate the risk of each one of those applications from the business and security perspective, give priority to each one of those, and make sure that they were ready to be integrated, and of course, right away go through the integration side. Of course, with communication and training for the end users to access their applications through your identity provider. But in some cases, we had a very good feedback, like, okay, this is a great place where I can find all of my applications, not just the ones that I used to use before, but the ones that are used enterprise-wide. So now I have this place, and I'm talking as a user, right? Now I have this place where I can find all of my applications where I need to authenticate just once, where I can just click on an icon and access seamlessly, right? So we have had that good feedback because of, we have thought about the process. Of course, we have had challenges with, especially with sources of identity, but in general, I think the acceptance of having a centralized identity provider from the acquisition perspective has been very, very good.
And you touched on the notion of apps and the need to make sure that people are both provisioned and have access and are provisioned to all the apps. And this is a challenge too, because there's so many different types of apps out there. There's commercial apps. But then you have your own developer population within your organization that you need to work with.
Yeah, and I think that's one of the things that we want to do. It's if you already have a single sign-on, if you already have an whole identity and access management provider, you can leverage all of those features also for your homegrown applications, right? You don't need to reinvent the wheel if you have an identity provider that can support your development effort. So what I mean with that is we have this development community, we have all these talented people developing applications for healthcare services and for all, not just healthcare, but other processes within the company. Then you can reduce the effort from developing ways of authenticating to those applications if you already have an identity provider. So if you adopt that identity provider and you transfer that knowledge to your development teams, that's going to make those applications to be you will focus your development team on developing the core functions of that application instead of trying to develop something that they already have in your identity provider, which is all the mechanisms around authentication, authorization, and accountability.
Yeah, developing identity is not much fun for a developer if they're focusing on a much more high-value clinical application.
Correct.
All right. Well, I think that sort of goes through some of the top-level messages we wanted to talk about, the importance of identity in providing and offering productivity and making things more seamless and easy making apps more seamless and easy for a provider as well as a provider's partners to access. We talked a little bit about the role of centralized identity and security to make sure that you know who the user is and what applications they can access. We talked a little bit about provisioning, making sure the right user is provisioned and probably more importantly, deprovisioned so they don't have access to an application when they no longer need it. And then, we talked about just evolution of the market where through M&A you need to bring in other IT organizations and other providers into your organization in a seamless and secure way. And then, of course, make your developers more successful when they're developing their key clinical apps, that they don't have to worry about things like identity because that's probably not core to what they should be doing anyway. So I think with that, we could probably open it up for questions. And get some feedback from the audience.
Okay, Sergio and Ron, thanks very much for that informative IT security presentation. And it is time for questions. Just as a reminder, you can continue to submit questions using the Ask a Question panel on your screen. So with that, let's go to our first question. Looks like this one's for Sergio. Do you find regulations to be a help or a hindrance when it comes to identity and access management?
I would say that they are definitely a help. I mean, it depends on how you address all those security controls in those regulations. But it's always better to have a guidance that was developed for some reason. If you go through each one of those security controls and you analyze them and find the ways to implement them and enforce them, that will definitely be a help for your organization to improve your security posture and reduce your risk and your attack surface, right? So it's definitely more a help than something that can stop your business. And if you find creative ways of have a balance between productivity and security, it will definitely be a help for any organization.
Okay, thanks. Looks like the next one's for Ron. Are identity and access management solutions scalable as organizations grow?
Well, they have to be, right? And we know, and we talked a little bit about this earlier. Healthcare organizations are growing organically. So, if you use a cloud-based identity and access management, you can grow by just adding more seats, right? So your identity system can grow as you grow organically, and that's just a function of just adding new seats as you add new employees. But then we also talked about sometimes you grow inorganically, and it's not sometimes; it's actually pretty often. And there you have to there you may be onboarding hundreds or thousands of clinicians, of support staff, of patient records, all at the same time. And you need to be able to think about how are you going to manage identity for all the reasons that we talked about: increased productivity, security, compliance and provisioning and deprovisioning. You need to think about how you're going to manage that, not in an incremental way, but in a massive step-up way, where the next day you have thousands of new identities, or maybe even tens of thousands of new identities that you need to manage. And the good news is that the industry understands this, and there are a number of solutions, I mean, of course, Okta included, that provide the ability to very rapidly scale up and manage new identities almost overnight. And I think we're all very familiar with, keeping things in Active Directory or in directories all over the place. That you may have several directories all over your organization or your acquired organization. Well, what's key now is the ability to sort of abstract away the identities from the directory, so the identity doesn't become tied to a directory wherever that directory happens to be, but you can abstract away all of that information into something like a meta directory, which allows you to manage identities, which allows you to provide access, which allows you to secure identities, which allows you to provide provisioning from a more abstracted way through a meta directory than by trying to go into the hundreds of directories you may have all over the place and trying to manage each one individually. And that's just one example of how cloud-based identity does help provide scale and is able to grow as you grow, whether you do that organically or inorganically.
Okay, so another question for you. What internal stakeholders are best to have involved to select an identity solution?
Well, I mean, you certainly need to be talking to the senior members of the IT staff, so the CIO or the CTO, to make sure they're brought on board, and then looping in your security organization, senior people within the CISO organization, because as we talked about, identity isn't just about providing access, but it's also about securing access and securing that individual. And then I think Sergio just mentioned actually a great point is that you're going to have a lot of developers and they're developing apps, and you don't want them to be spending their valuable time developing identity into those apps. You want them to be developing the apps that help you provide excellent, patient outcomes. So making sure that your developer community is well engaged as well, and that they realize that as they're building their apps, they don't need to think about identity. You've got it covered. And then an interesting conversation is always with the HR organization, because of course they're the key to a lot of identity. They know who's coming or going, and they know more about the user than perhaps the rest of us. So making sure they're looped in as well. And there's a lot of great ways to connect HR systems with applications, so those HR systems can be the source of truth, for example. So as somebody comes and goes, that can kick off an automated process that would provide access or revoke access depending on that person's state with the HR department. So that's another key organization you might want to talk to.
Okay, so you touched on a lot of different roles in terms of stakeholders, but taking a step back, I think this one would be for Sergio. You guys touched on this in the presentation a little bit in talking about providers and the value of the provider role, especially to attackers. Can you expand a little bit more on how certain personas are more susceptible than others for cyber attacks?
Yeah, sure. So definitely providers will be one of the favorite ones because, as we mentioned, they have access to multiple systems and applications that host PHI, and we know that they will be always in a hurry on doing what they have to do day to day, and probably they will be clicking on phishing campaigns or accessing applications they should not, but just because they are focused on their day-to-day activities, so they will be definitely one of the favorite personas to attack. Also, senior members of senior staff on top management, CEOs, CFOs, they will be, because of their title, of course, they will be one of the most susceptible to be attacked. So on the healthcare industry, I would say providers as well as top management members will be the favorite ones to be attacked with all sorts of types of attacks, right? Not just phishing, but other methods of impersonation or identity theft.
Okay, great. And this is for whoever wants to answer it. Maybe the last question. There was someone who wrote in wondering where the balance is in staying secure, but also being nimble with the ever-changing IT options.
Probably I can answer to that question. So I think automation it's key here because roles change every day, right? And they can, you can have users with multiple roles and responsibilities. So you always need, of course, to define a process and define policies behind who should have access to what, right? That policies are always foundational. So once you have your policies in place, you have your process in place. Now, the key element is automating that. How I can, at the same time, provision access to something and then provision access to something else, and keep that balance between I have a user that needs access to all these systems, but I also need to make sure that that user doesn't need access to other systems because his role has changed. So first, defining your policies, defining your process and procedures, and then looking for automation and mechanisms like identity providers to enforce your policies and to make sure you are changing at the same time your business is changing with the changes of roles and responsibilities of each one of your users.
Okay, great. Well, with that, we have to wrap up. So thanks again for a great presentation and answering those questions. Those of you in the audience, please share your feedback with us in the evaluation. And as a reminder, the on-demand version of this session will be available for your listening pleasure for 1 year on the HIMSS Learning Center website. Goodbye for now and have a great day.